Tudorza Pressair is a prescription medication that contains the active substance aclidinium bromide. It belongs to a class of drugs known as long-acting anticholinergics. Tudorza Pressair is formulated as a dry powder inhaler used for the maintenance treatment of chronic obstructive pulmonary disease, including chronic bronchitis and emphysema. Aclidinium bromide works by blocking the action of acetylcholine, a neurotransmitter involved in bronchoconstriction, thereby helping to relax the muscles in the airways and improve breathing in patients with COPD. Indications: Tudorza Pressair is indicated for the long-term maintenance treatment of airflow obstruction in patients with COPD, including chronic bronchitis and emphysema. It is used to improve symptoms such as shortness of breath, cough, and wheezing associated with COPD. How to use: Tudorza Pressair is for inhalation use only and should not be swallowed or taken orally. Before using the inhaler for the first time, prime it by pressing the green button down fully and releasing it. Repeat this step until a fine mist is visible. To use the inhaler, hold it in a level, horizontal position with the green button facing up. Exhale fully and place the mouthpiece between your lips, forming a tight seal. Inhale deeply and forcefully through the mouthpiece to release the medication into your lungs. Hold your breath for a few seconds before inhaling slowly. Rinse your mouth with water after each use to help reduce the risk of oral thrush. The recommended dosage of Tudorza Pressair is 1 inhalation, equivalent to 400 micrograms of aclidinium bromide twice daily, approximately 12 hours apart. Do not exceed the prescribed dosage or frequency of use unless instructed to do so by a healthcare provider. Contraindications: Tudorza Pressair is contraindicated in individuals with hypersensitivity or allergy to aclidinium bromide or any components of the formulation. Severe hypersensitivity to milk proteins, as the Pressair device contains lactose, which may cause an allergic reaction in individuals with severe milk protein allergy. Special instructions: Tudorza Pressair should not be used with a spacer or holding chamber, as this may affect the delivery of the medication. Store Tudorza Pressair at room temperature away from moisture and heat. Keep the inhaler device dry and clean at all times. Side effects: Common side effects associated with Tudorza Pressair may include dry mouth, cough, upper respiratory tract infection, headache, sinusitis, sore throat, nasopharyngitis. Less common but more serious side effects may include urinary retention, worsening or narrow-angle glaucoma, and allergic reactions. If you experience any persistent or severe side effects while using Tudorza Pressair, contact a healthcare provider for future evaluation and guidance.